Hello again. The idea of criticising the National Health Service is for many British people tantamount to heresy. It is the one state organisation before which we all bow down in adoration. Of course, part of that is that it is so stupendously expensive, costing more than £10,000 a year for every household in the country. You know what it's like when you've invested a fortune in some dubious scheme. The last thing you want is a smart aleck coming along and telling you you've been had and that you've in fact been the victim of some elaborate scam. You keep hoping against all the evidence that you really will become a millionaire, just as you were promised by the tricksters who took your money. It's a bit like that with the National Health Service. The evidence, though, is pretty damning if you look at it objectively. The think tank Civitas recently released a report comparing British health and life expectancy with that in 18 other wealthy countries. In other words, the world's rich countries, of which we are one, United States of America, Canada and so on. Guess which of those countries had the worst 5-year survival rate for cancer of the colon? Common enough cancer. That would be Britain. What about things like lung cancer and stomach cancer? Second worst out of 19 wealthy countries. None of this will really come as a surprise to most viewers who will, like me, know that it is impossible to see a doctor in person these days, and that as a result, the early signs of many serious illnesses such as cancer are being missed. If my doctor doesn't even take my pulse or measure my blood pressure, as he once did every time I visited him, how will he know about the state of my health? You can't do that sort of thing over the telephone. In the description to this video, I give a couple of links to the new figures about expenditure on the NHS and the death rates. So we know that our NHS is costing more and more each year, while at the same time delivering a service which grows worse and worse every year. Of course, if this were any other state body, we would be asking some serious questions about this model for delivering services. But we are in such awe of the NHS that we dare not do that. We've been brainwashed into the idea that the way we do things as regards health in this country is the only fair and equitable one, and that anybody who questions the current arrangements is seeking to privatise the NHS. Horror of horrors. You don't want sort of health services having in other foreign countries, do you? Even if they are cheaper, better, and give you a better chance of surviving cancer. We all know the traditional remedy for staff shortages in the National Health Service. It's increased immigration. If you look in the newspapers this morning, you will find that there is a terrible new staff shortage problem in the NHS. And already some people are muttering about the need for increased recruitment overseas, which sounds ominous. I might sound like a rabid right-winger, but I've had just about enough of encountering foreign staff in hospitals, people whose grasp of English is sketchy at best. If we are running short of doctors and nurses, then perhaps we could start training more people in this country. Hand on heart, how often do viewers get to deal with only British doctors and British nurses if they go to hospital? I can't think that increased reliance on foreigners is really the best solution to the problem anyway. I've remarked before, by paraphrasing the American economist Milton Friedman, that you can't really have free immigration and a welfare state. It's one or the other, but not both. Last year, 1 million residence permits were issued in this country for foreigners to come and live here, either to study or work. all those people will require free medical treatment. So in effect, last year, 1 million new patients were signed up to the NHS without having paid a penny towards it. So no, I don't think that more immigration is the way to fix the staffing problems in the NHS. Sooner or later, we'll have to ask ourselves questions about the very nature of our health service. Why must it be a national health service, for instance, rather than a local or regional one? We used to have cottage hospitals which catered for a small area, and the staff there knew what was needed in their district, whether it was a few villages or a small town. Now, somebody in Whitehall decides what is needed instead. All large public bodies tend to be inefficient, and the larger they get and the more centralised, the more inefficient they grow. I doubt if it will happen, but it'd be nice to think that the next Prime Minister of Britain would be willing to grasp this nettle and reform our health service, which currently resembles something in the old Soviet Union. I am very far from sanguine about this possibility, though.